Hi, this is Scott Mace for Scott Mace on Healthcare, and I'm here with a video tour of the Continua booth at Consumer Electronics Show.
My name is Rich Rogers with IBM.
Okay.
And IBM is a member of the Continua Health Alliance, which is what this booth is here today. And so what Continua is about is personal telehealth, so remote patient monitoring scenarios, telehealth, telemedicine. And what we're showing here today is some of the Continua member company products, medical devices, and gateways to connect those devices to back-end services such as healthcare provider applications like electronic medical record systems, for example. So the IBM part of the story here is, we don't manufacture devices or gateways, but we have server software that can collect this information using the Continua standards that have been agreed upon by the member companies. So once the data is collected into the IBM environment, we can then do things like making that data actionable through complex event processing, business intelligence, integration with some of the provider applications, disease management, etc. So we can show you some of what we have here today.
All right.
I'll just kind of show and tell here a little bit. We've got a blood pressure cuff here from one of the member companies, A&D. We've got a pulse oximeter from Nonin. We've got a glucometer from Roche. We've got a gateway device from a company called Eurotech. They're a member company of Continua, a business partner of ours. This is a gateway device. It's an appliance that would be in the home and would work with all of these medical devices here. We've also got a smartphone application. Same concept as the Eurotech device. It can communicate with all these medical devices and then transmit the readings to the back-end IBM services.
Okay.
We've also got a weight scale over here on the floor from A&D.
So my colleague here can step on the scale. Take a live reading on the scale.
Okay, so you just kick the blue thing in the front to start it. So what's going to happen is he'll step on the scale, he'll take a live reading, it'll transmit that data via Bluetooth to the smartphone. The smartphone will transmit over the cellular network to a server at an IBM location. In this instance, this server is actually located in France. And then I can bring up on the screen the actual portal that shows the data being collected from that server. So if we start on the screen, actually, before I change screens, this is sort of the overview diagram of what I just described, where we've got the devices over here on the left-hand side. We've got continuous standard interfaces defined for how those devices communicate with the gateways, the smartphone, the home PC, or the appliance. And then a set of Continua interfaces for how those gateways in a standard way communicate with back-end servers, in this case the IBM ones. And so now what I'm going to do is switch screens so you can see the portal running off of that server in France and see the data show up live.
Okay.
All right. So the first thing is, to think of a scenario for telehealth where a clinical office has a case manager that's managing a set of patients. And so the idea is to have dashboards with some logic built in, such as you see here, a red, yellow, green type of a story, so that they can get alerts and indicators, trends, patterns that they can pick up about their patients from their use of the devices and the readings, off of those devices. So then we can zero in on a specific patient. So if we're looking to treat a particular patient, in this case it's this Lori Thompson, everything's working correctly. It's a little bit slow because it's a demo environment and it's running off of this server in another continent. But eventually what will happen here is we'll see a report that shows the live reading that was just taken by my colleague. Okay? So here's blood pressure information. If I scroll down, we'll see the weight information as well. You just see the yellow reading there, 173. So that's the reading that we just got off of the weight scale. And all of this stuff works together through these standards, right? So the technology that's built into the A&D device, the platform that's used by the smartphone, and the technology that's used in the IBM environment The only common thread through all of that is the fact that we're all using the same standards. So it enables this plug-and-play interoperability, flexibility for consumers. That's our story.
Thank you very much.
Sure. Thank you, Scott.
Okay, why don't you tell me who you are and what you're showing?
Hi, I'm Joe Crackle, and I'm with Nonent Medical, and I'm showing today Nonent's Onyx 2 9560 with Bluetooth.
Okay, and what does that do?
This does is it measures the oxygen in your blood, and it also measures your pulse rate.
Okay, and what can you do with that information once you've got it?
The nurses can use this information to treat their patients. So if the measurements are changing or decreasing, the nurse can intervene and treat the patient.
Okay, so why are you at CES in this connected home area here?
Well, we're at CES here to demonstrate our interoperability with Continua certified products.
Such as what?
Such as the VigNet application.
And what does VigNet do?
VigNet takes data using the Continua protocol from devices such as pulse oximetry, weight, and blood pressure.
Okay. And you'd use this at home, or would you use this in the clinic, or both?
This would be used in the patient's home.
Okay. And then what would happen to that information after they had that information?
That information will be sent to a server. That server will then pass the data into a personal health record or into an electronic health record that the nurse can remote monitor the status of their patients.
Okay, great. Anything else you're showing here?
We are also showing our consumer pulse oximeter that we sell on Nonent.com, $99 personal oximeter.
So that's a standalone product?
It is a standalone product.
Okay, but you have the connected stuff too if people got that all together?
Right, we have the connected for the disease management.
Okay, thank you very much.
All right.